Good afternoon, everyone, and thank you very much for your time and attention. A special thank you to CIICA for allowing the IFA to be part of this conference today. My name is Roxana Battier in representation of the International Federation on Aging, as some may know it as the IFA. And today we are here to discuss hearing in later life, expanding access to cochlear implants for older adults, and improving quality of life through person-centered care. Now, as a little bit of background for everyone, population aging is a rapid global phenomenon that has profound implications for all aspects of health and well-being, as well as health systems development and sustainability. By 60 years of age, the major burdens of disability and death arise from age-related decline in function, as well as non-communicable diseases. To enable well-being with aging and to decrease health systems costs, it is therefore imperative to develop public health responses that focus on developing and maintaining intrinsic capacity and functional ability across the life course. A statistic that everyone in this room is familiar with, and as reported by the WHO World Report on Hearing, globally, more than 1.5 billion people experience some degree of hearing loss, which translates to about 1 in 5 people worldwide. By 2050, this number is anticipated to grow by 60% to 2.5 billion. This means that 1 in 4 people will experience hearing complications. This trend parallels the rapidly aging global population. By 2050, the projected number of persons aged 60 years and older will double to 2.1 billion people, and the subpopulation of those aged 80 years and older is expected to triple to an estimated 426 million individuals. The rapidly aging global population, with over 65% of persons older than 60 years experiencing some degree of hearing loss, places the importance of integrating hearing health into health systems transformation high on governmental agendas in the UN Decade of Healthy Aging. Now, to provide context for folks, the UN Decade's 4 action areas include combating ageism, age-friendly environment, integrated care, and long-term care, and these are underpinned by a rights-based approach to healthy aging. Complementary to this, 4 enablers to shift the status quo amongst the areas for action include voice and meaningful engagement, leadership and capacity building, connecting stakeholders, and strengthening data, research, and innovations. Now, hearing in later life presents an unparalleled opportunity to actively not only support, but exercise each of these enablers of the decade synergistically, while simultaneously also advancing hearing policy measures across the 4 action areas of the Decade of Healthy Aging. Despite growing evidence of the association between hearing health and healthy aging, there are many barriers to ear and hearing care services for older adults, including access to cochlear implants. These barriers and disparities are rooted in inequities of health-related and socioeconomic resources, which is particularly amplified for older adults. This includes limited awareness and knowledge of cochlear implants, eligibility criteria, stigma, and its correlation with ageism, as well as the referral processes and some structural barriers So when we say structural barriers, this can include transportation difficulties and the complex hearing care delivery system pathways for older adults across countries. And these all act as barriers to cochlear implant access, which can include assessment, referral by healthcare professionals, screening, and so forth for older adults. And this is against the overarching backdrop of the management for cochlear implant and services that need to be person specific for the older adult in question. Now, consolidating the UN Decade of Healthy Aging, the WHO guidelines on integrated care for older people, and the World Report on Hearing recommendations. The prioritization of person-centered integrated care warrants coverage of hearing care for older adults in healthcare systems globally, and this requires the urgent interdisciplinary engagement and coverage amongst all intergovernmental agendas to deliver a unified and cohesive voice. This voice needs to advocate for integrated person-centered ear and hearing care within national health plans for universal health coverage. Hearing loss, particularly as we age, is about the person. It's about the person, their value, their identity, their productivity, and their place in society. So person-specific needs with the dignity and value of the person really should be at the forefront of all services, including access to cochlear implants, with solutions also accounting for this. However, one prominent and consistent gap that needs to be addressed is the need for the aging and hearing experts to join forces and work together. Fostering interprofessional and interdisciplinary collaboration to move the need for the integration of aging and hearing health continuously forward is key, because there is no person-centered care if interdisciplinary collaboration is not part of that equation or discussion. Now, as a final key takeaway, I again just want to articulate that in order to expand access to cochlear implants for older adults and deliver person-centered care, we need to join forces together. So what this means in this context, we need the aging and the hearing fields and experts to join together, foster interprofessional and interdisciplinary collaboration, and this is a crucial step to integrate person-centered ear and hearing care into health systems globally. Now, a final thank you to CIICA again for this incredible conference and for allowing the IFA to be part of the discussion. Thank you very much, everyone, for your time and for your attention.